Hello, it's me, Miss Johnson Alexander. If you hear some noise in the background, it's my daughter's vibrating chair. It keeps her quiet. If there is loud hollering, then there will be a part 2 to this video. Just warning you now. So, we'll begin. You had the assignment to do that's due next week, January 30th, Wednesday, January 30th, but you'll turn it in to Miss Bean. It's in D2L, the directions for it. Chapter 1, you do the review questions at the end of the chapter, and Chapter 2, the review questions at the end of that chapter. The next chapter in the syllabus is Chapter 8. This lecture is going to be over Chapters 1, 2, and 8. 8 is very important. It is the injury process introduction. If you don't understand how the injury process works, then you will not follow anything I'm saying when I talk about rehab, when I talk about exercises and things like that. Also, you need to make sure you know all the motions of each joint. So that's the neck, the shoulder, which is very complicated. It has a lot of different movements. So the neck, the shoulder, the elbow, the wrist, the fingers, go down from there, the hip, the knee, the ankle, okay? And those are the joints that we cover as far as rehab goes, where you need to know what those range of motions are. Range of motion, I keep saying that. You'll hear me say ROM. ROM stands for range of motion. Now, moving back to Chapter 1, it is an introduction. It talks about sports and how those injuries are caused. You read. I give my tests, by the way, are part from the book and partly questions I made up in scenario real life situations. So the book and the test, and my own made up questions make up your test. All right, it's not just based on my lecture. It's your job as the student to read, and if you have any questions for me, ask them. And I made myself available for you to do that by phone and or email, but phone is more efficient. But with that being said, I hope you've also turned in your Week 1 assignments. Today is Thursday. Those were due yesterday, Wednesday, the second week of school, to Miss Bean. That was the hyper course questionnaire, and that was also the syllabus quiz. So, moving right along, you were also instructed to outline each chapter by hand. And what I mean by that is under each heading, you can summarize in bullets. I don't want paragraph form. I want bulleted lists. Summarize key points under each section heading. For example, in Chapter 1, there's section headings of sports medicine, key members of the, that's Chapter 2. In Chapter 1, headings such as stress fracture, very important chapter, Chapter 1. Stress fracture, the types of fractures, the 5 types, what you look for, sprains and strains, and then, of course, as I said, injuries and different sports that are common sports injuries. Also, the characteristics for sports injury, what must be, what's the definition for a sports injury. That's also in Chapter 1. So let me go ahead and get started. It mentions the National Federation of State High School Associations. That's now National Federation of High School Sports. That has an assignment for you. That assignment is to get on the website. It's in your syllabus. Get on the website and do the concussion course. It's free. You get a certificate. You need to print out 2 certificates or make a copy of one, because you'll keep one for your records. In the state of Oklahoma, you have to take that course in order to coach. So if you look at coaching, you already have that along with your resume to turn into any AD. Okay, so what makes a sports injury? There's 3 things that must be present. Chapter 1. It must occur as a result of participation in an organized practice or game. It says intercollegiate, but if you're going to go into the high school level, same thing applies. It has to be practice or game. It requires medical attention by a team athletic trainer or physician. Medical attention is the key. Results in restriction of the athlete's participation. They cannot go 100% due to that injury. So those are the 3 components for a sports injury. Eccentric contractions. You learned this with Mr. Larner, Mr. Shelby. Eccentric, you need to know what the muscle does. With eccentric, the muscle lengthens, and with concentric, the muscle is shortening. You get your strains, your strains, which happen to muscle or tendon. You get your strains, remember the T for tendon, but you get your strains from eccentric contractions. For example, running or sprinting, get a hamstring strain when you are in knee extension, because the hamstring's job when it shortens is to contract and shorten. So that's concentric. You get your injuries in the eccentric phase, okay, when the hamstring is lengthening to counter the quads, okay. Acute injuries versus chronic. I use the 3-month rule. After 3 months, it's no longer acute. It becomes chronic. So, ankle sprain is an acute injury. You can have repeated ankle sprains, but then it might cross into chronic. But things like back injuries, repetitive motion injuries like carpal tunnel and wrist injuries, those are chronic. Sure you know the difference between those. Soft tissue, fascia, joint capsules. Okay, around the joint, we'll use the knee for example. Around the joint, you take the femur and the tibia to make the knee. The femur, the tibia, and the kneecap, which is the patella, to make the knee's joint capsule. Okay, to make the knee joint. But around that, in that is fluid to nourish all 3 bones, nourish the meniscus, nourish the ligaments that are in the knee, and that is the joint capsule. Okay. Catastrophic injuries. When we talk about concussions, head and neck injuries, that's usually where you run into catastrophic injuries. Also with heat exhaustion, heat stroke, that could become catastrophic. The definition for catastrophic: often involve damage to the brain or spinal cord, potentially life-threatening or permanent. Okay? You can have a ruptured spleen, which can become life-threatening, lacerated liver in your contact sports, where the liver just literally is cut open, or the spleen is cut open internally. Football is the usual culprit for those 2 injuries, but they are catastrophic injuries. They are life-threatening injuries. Okay, injury classifications. Sprains. Okay, there's 3 degrees of sprains and 3 degrees of strains. It's the same 3 degrees. You have first, second, and third degree. All right? First degree, it's just simplest definition I can give you. First degree is stretching of the ligament, muscle, or tendon. Second degree is slight tearing of the ligament, muscle, or tendon. And third degree is a complete rupture of the ligament, muscle, or tendon. Remember, if it's a sprain with the P, it's a ligament. If it's a strain with the T, it's a muscle or a tendon. Don't get those confused on my test. Those should be easy points. Avulsion fracture is mentioned when a bone is pulled off due to a very bad strain, because remember, tendons attached to bone. It could happen with ligaments also, but since ligaments attach bone to bone. But whenever it's severe enough that it takes a chip of the bone or a piece of the bone with it when it completely tears, that's called an avulsion fracture. You need to know the signs and symptoms of those 3 degrees, and it's given to you in the book. Contusion, it's just a bruise. You also have laceration, which is a cut. Contusion is a bruise. Puncture, it's like stepping on a pointed object. Abrasion, scraping of skin, like getting a carpet burn or falling on asphalt, scraping the top of the skin off. That is an abrasion, and you need to know those things. Definition for ecchymosis, definition for hematoma, and myositis ossificans. You need to know those definitions. Fractures. There are 5 types of fractures listed in your book with good pictures depicting each of them. You need to know those 5 for my test. And it gives you a bulleted list of signs and symptoms to look for with fractures. Now, stress fractures. Stress fractures come from overuse. Okay? Overuse. So running on improper surfaces, running on concrete which doesn't give, running too much, doing too much too soon. Your shoes could be worn down, not having enough cushion, not running in the right shoes. You shouldn't be running distance and things for preseason in your basketball shoes unless you're on a basketball court. So if you're running in the improper shoes, of course, that can cause stress fractures. And then sometimes just the makeup of your body. If you're flat-footed, you're more prone to stress fractures. If you have an extremely high arch, you could be prone to a stress fracture also. Okay, dislocations. Subluxation. It's partially dislocated, but to go further, subluxations, they do what's called, when you have a dislocation, it has to be what's called reduced. Reduced means put back in place, and that is only done by a physician. Now, I know you're going to say I had coaches that did that when I dislocated my finger or my shoulder or whatnot. That's out of a coach's what's called scope of practice, okay? That's out of an athletic trainer, a certified athletic trainer, which I am one. That's out of our scope of practice, because when you reduce a dislocation, you can pinch off the nerves that are feeding that joint or pinch off the blood supply that is feeding that joint. And if any of those things are done, you have just, you've either the person's going to lose function in the limb or lose the limb because you cut off blood supply to the tissue. Okay, that's why it's out of our scope of practice for nerve damage or blood vessel damage when we reduce. Also, when you dislocate, excuse me, my nose is itching. Also, when you dislocate, you can sometimes damage those blood vessels and nerves, and doctors would know what to look for and are put with that task to know what to look for. Not coaches and not athletic trainers. Epidemiology of sports is what I was talking about earlier. It gives you common sports and how they're classified and common injuries with those sports. And that's the end of chapter 1. You have review questions to do, 16 of them. On to chapter 2. This talks more about how to become an athletic trainer. I don't hold you to those things. You only have to answer questions 1 through 5 out of chapter 2 review questions. But sports medicine tells you who an orthopedic surgeon is. Key members of the team. That's the athletic trainer, the coach, and the team physician. Those are the key members of the team. Coaches, you still have to know how to do first aid and CPR and work in AED. Okay, you can't just say I'm the coach and that's the athletic trainer's job. You still are responsible for that, for those life-saving skills, because you should keep your certification current. So if